Thank you for joining us today for the COVID-19 update with Henry Ford Health System. Today we have Dr. Adnan Munkarah, who's Executive Vice President, Chief Clinical Officer. One of the things he'll be discussing is a news release that we just issued a few minutes ago, in the last half hour, about the preparations for the COVID-19 vaccine distributions that will take place soon at Henry Ford. Dr. Munkarah, thank you for joining us today.
Thank you, Tammy. I want to start this update first by expressing my gratitude to our patients, to our communities, to our amazing staff members and healthcare workers in our system and also across the state and across the nation, to our essential workers, to everybody who has supported partnering in fighting this pandemic, and to all of you who have been really steadfast in making sure that you communicate what's important regarding the virus and the spread of the pandemic. And I wish all of you a happy and safe Thanksgiving. Starting with some of the updates that we have and that we do on a regular basis, I'll start with giving you some statistics, some of the things that we have been seeing and some of our preparation. First, with respect to statistics, unfortunately, we continue to see staggering numbers of new COVID cases. As many of you have seen, last numbers from around the nation, 176,439 cases within a matter of 24 hours. In Michigan itself, the 24-hour number was, the last 24-hour number was 6,853 cases. The number of deaths is sobering. We are starting to see we were before looking at numbers that were in the few hundreds, and just one death related to COVID is by itself a tragedy. But imagine losing 2,200 people to COVID within a matter of 24 hours around our nation. In our state, 157 patients have died of COVID within a matter of 24 hours. This is almost double the average that we have, the 7-day average that we have seen before. So when people talk that, COVID is less, what we are seeing now is a less deadly disease, it might be less deadly when you are comparing to the huge number that we have seen in the spring, but it's by no means a disease that is like the flu, where we are not seeing significant acuity. When we look at our testing numbers, these are again very concerning. Our test positivity rate today was 22.9%. This means out of people who we've tested in the past 24 hours, 22.9% tested positive. When we look at our patients coming through the emergency department, 35% of them are testing positive. So when people come in with a fever, cough, or symptoms to suggest COVID or to suspect COVID, and when we're testing them, more than 1 in 3 people are testing positive through in our emergency departments. With respect to the patients that are hospitalized at the present time, at Henry Ford Health System, in the past 24 hours, the total number of COVID patients we are caring for within the walls of our hospitals is 425. Out of these, 390 are COVID positive confirmed testing, and 35 are suspected. So their testing is still pending, or we highly suspect that they have COVID, even if the initial test came back negative. So a large number of patients, and we have continued to see in these numbers over the past week to 10 days. Henry Ford Macomb Hospital continues to be the place where we have the largest volume of largest volume, and where we have the highest number of patients. 136 patients are admitted with COVID at Henry Ford Macomb Hospital. We have also seen an increase in the number of patients admitted at Henry Ford Hospital in downtown Detroit. We are up to 82 patients with COVID at our Henry Ford Hospital. Out of those patients who are admitted, 115 are in the intensive care units. This means 1 out of 4 patients who are admitted with COVID to our hospitals are needing intensive unit care. Out of the people who are in the intensive care unit, a total of 56 are on ventilators. So almost 1 out of 2 patients who are in the intensive care unit are needing to be placed on mechanical ventilation for their COVID problems. when we are looking at our concerns at the present time, staffing continues to be a significant concern for two reasons. One, the climbing number of COVID cases that we have to take care of and the number of patients that being admitted to the intensive care unit at the present time. And two, the fact that we continue to see a significant number of our employees exposed in the community and needing to be off work. In the past 7 days, we had 158 employees who have tested positive for COVID-19. We have tested a total of 890 employees. So our percentage of positivity among employees of those who have been tested is 17.8%. Obviously, we are not testing everyone. We are testing people who come in because they are symptomatic or have exposure. And this is the number that is reflected in those statistics that I have shared with you. What we are also continuing to see is the vast majority of our employees who are testing positive are related to community exposure, not related to work exposure. We continue to implement very, very safe rules with respect to our use of personal protective equipment, including the use of surgical masks and 95 when appropriate, gowns, hand hygiene, social distancing. So we feel very safe at our facilities with the measures that we have implemented. But the problem with the number of cases continuing to climb in the community, the exposure that all of us are witnessing at the present time, irrespective of where we are, is very, very high and very significant and very highly concerning. We are doing fine with personal protective equipment and continue to have inventories that we feel can save us that can provide us with the coverage for the next 100 days. We are very excited to announce our mask campaign, our All for Detroit and All for Jackson mask campaign. Our system is proud to be distributing 260,000 masks throughout our communities. These are masks that we strongly feel are important to protect all of us, all of our communities. We continue to strongly believe that wearing masks, social distancing, practicing good hygiene, and avoiding large gatherings indoors are extremely important in fighting COVID-19 and in protecting ourselves from contracting the coronavirus until we have a vaccine and enough immunity in our community. So this is why we are very excited to share these masks, and we are ever grateful to the artists who have allowed us to decorate these masks with their inspiring works. Many of these are local artists who have helped us do that, and we are ever thankful to them. And we'll be very grateful anytime, and especially during this season of extending thanks and gratitude, if all of us put these masks to use. If all of us use these masks when we are out so that we can continue to protect each other, our loved ones, our families, and our friends. Some of the numbers that we are seeing with the holiday season, despite the precautions and the guidelines that have been submitted, asking people to try as much as possible to travel during this holiday season, and understanding and empathizing that people want to be with families. What we are seeing is a very large number of people trying to travel during this week. In fact, it has been reported that more than 3 million people have passed through US airports this past weekend, traveling before Thanksgiving. People are standing in lines in millions across the nation to get testing, and they feel that by getting testing, they are going to protect themselves and their family. As we have shared with you before, a test is a snapshot in time. It is not protective by itself. Getting a negative test and then going into large gathering does not mean that we are protecting ourselves and or our loved ones, because the test might have been taken at a time where the person who is infected has not converted to positive testing yet, or the person who had a negative test might be exposed post-test and then expose their families and loved one to that. So this is why we do not believe a negative test is sufficient to protect the community. And what we know that gatherings within indoors. For groups that are bigger than 6 or 6 to 10 and more are really areas and risk factors causing significant exposure. We are also very concerned about students coming back from colleges. We know that there have been significant spread among college students, and these students, and they come back and mix and mingle with their families and their friends. We are very concerned that will increase the exposure. We also know that Black Friday is a big day for our communities, and people tend to go and shop and get gifts for their loved ones and for themselves. But being in crowds and being in closed areas at the present time, all what it is going to do is increase our risk of seeing more and more cases as we head into December and as we approach the rest of the holiday season. The best advice that we can give to anyone during this holiday season is to make sure that we limit our gathering to small groups, to our household. These are the people to have dinner with. Let's have virtual Thanksgiving dinner and lunches. Let's try to kind of connect virtually this season so that hopefully in 2021, we'll be able to get together all in a healthier community where people are able to connect and sit around each other and enjoy each other's company in person, rather than having to deal with the risk and significant concern of loved ones being infected and having to be hospitalized or in an intensive care unit in the next few weeks. We also urge our loved young college students who are coming back to be with us to try not to mingle with their friends and to go out there and gather in big groups that are going to cause an increased risk of infection. To our patients and our community, we know that delaying care during the spring has caused significant impact on their health. So people have delayed care for cardiac condition, for neurologic condition, stroke, for cancer, or any other conditions have fared worse. And this is why our commitment has been over the past few weeks is to make sure that we continue to provide the care that our patients need and deserve. It is much riskier to stay home with a cardiac condition that needs immediate attention than to present to the emergency department or to the doctor's office. We have been trying to do everything possible to make sure that we extend different options to our patients. Our clinics continue to be open. We continue to provide safe environment in our clinics to our patients and to their families so that they can see their doctors when they need to. We also have extended our virtual care, and we have extended also access through our electronic as well as telephonic encounters so that people can email their physicians through MyChart, which is our electronic medical record version for our patients, or through connecting with their physician through phones. But when people have significant complaints and problems that need to be attended to in person, we urge you to make sure that you do not delay care, because this will not be safe. We also want to kind of extend our sincere apologies to some of our patients who might have, and their families who might have experienced long wait on when they are calling us or reaching out to us. We've been challenged, like many other healthcare systems in the region as well as around the nation, by the number of calls we are getting because people are concerned, they are anxious, they want to get answers to their questions, how to handle an exposure before seeing a family member, or how to handle exposure after seeing a family member, how to do for testing, should they get testing before they are with their families. So this has put a significant really strain on our lines and on our phone lines and our ability to answer people as fast as we would like to answer them. We continue to work on this to make sure that our access continues to be improved so that people can reach us when they need to. What we have also done, we have developed a list of community resources for people who are not direct patients of ours and who might be calling us to ask for community resources regarding testing. We have developed a list that shares what are these resources are. And one of the easy ways, in fact, to do that is to go to the website michigan.gov, because there are many of these resources there. We also have implemented online screening tools so that the people who are trying to reach us, rather than trying to call us, they can reach us through online screening tools. And we talked about the MyChart, which is the electronic medical record version for our patients. With respect to vaccines and treatment, as Tammy has mentioned earlier, we continue to be in our full preparation as we are awaiting the first batch of vaccine that will be allocated to us. We are very excited to let you know that we have had all the freezers that are needed to store both the Pfizer and Moderna vaccine when they become available to us. These have been set and activated at all our hospitals, at Henry Ford Hospital, Henry Ford Wyandotte Hospital down in Wyandotte, in the Downriver area, Henry Ford Macomb Hospital in the Macomb County area, Henry Ford West Bloomfield Hospital, as well as Henry Ford Allegiance in Jackson. In addition, all of these hospitals have been approved by the Michigan Department of Health and Human Services as location and site for vaccine allocation and distribution. So all of these hospitals will be receiving vaccines, and that they will be able to distribute and inject. We do not know the numbers that we'll be getting at the present time. We continue to await what the state will be getting, and there will be allocation to all the healthcare systems, but we anticipate that all our hospitals will be getting an allocation of the vaccines. We continue also to be very excited about the fact that we are part of another vaccine trial. So the Johnson & Johnson on-sound COVID vaccine is active at the present time at Henry Ford Hospital. This is an adenovirus vaccine. It is somewhat different from the Moderna and Pfizer vaccine, and we are enrolling volunteers to that vaccine. It is extremely important that this trial, similar to the other trial, is highly representative of the communities that we serve. As we have said before, it is important that we understand what is the efficacy of the vaccine and safety among the different racial groups that we serve, among the different genders, among the different ages, the vulnerable populations. So this is why we are excited and ask people to continue to enroll in these studies in order to get all the information needed so that we have more and more vaccines available to us. We have also received our allocation of the monoclonal antibody by Eli Lilly. This antibody has received the emergency use authorization as you remember, about 2 weeks ago. So we have the first doses, we have set the clinical criteria for its use, as well as we have operationally determined how to do these infusions as outpatient. This is a treatment in the outpatient setting, specifically for people who test positive and who have mild to moderate symptoms. And we'll start the first infusions next week. We also learned that the FDA has granted the emergency use authorization to another monoclonal antibody. It's the one by Regeneron. This is the one that President Trump has received when he got sick with COVID. We do not know what is the expected time that we'll be receiving that allocation, but we'll also be prepared for that antibody like we've been prepared for the Lilly's antibody. We continue also to provide care to the patients that we have with different venues and using different approaches of treatment, including remdesivir, steroids, as well as convalescent plasma. I would like to thank you again for your attention and for being with us here, and I'm happy to take questions.
Thank you, Dr. Munkarah. You had specifically mentioned a couple of things that are coming up as far as the holidays, Thanksgiving shopping, college students coming home. Could you expand on those a little, please?
So for college students who are coming home, it is really important for them to be safe themselves and to keep their families safe. So some of the colleges are doing testing ahead. Again, it is not by itself sufficient protection. But when college students are back home, try as much as possible to do some social distancing, to wear masks when they feel that we've not got the test back yet, or if we are still concerned about their exposure prior to being home. It is very important they protect the family members who are around them. It's also important for them not to kind of gather in big groups. We know that they miss their friends and they want to be in big groups and big gatherings. And by doing that, they might be spreading the infection if they have it, or they might be contracting the infection from some of their friends who have it and might be asymptomatic. With respect to the shopping, I'm sure that the majority of people, if not everyone, has been shopping online or shopped online in the past few months. And this is a way for people to use online shopping at the present time, rather than standing in long lines or being indoors within shops or within malls. People will probably still show up to these areas, and we're not saying to shut down these areas, but people need to be thoughtful and to kind of be balanced in their approach to avoid big gatherings in large areas.
Thank you, Dr. Munkarah. We have a question from Paula Pesci. Paula, in the outlet.
Hi, doctor. I know COVID is the big concern, but it's also flu season. Have you seen many cases of the flu so far?
Thank you, Paula, for bringing that up, because I wanted to mention it also, and it skipped my mind. We've not so far seen a significant surge of the flu in our hospital, and we've not heard it around in the region and in the state. But this is where we strongly encourage people to take their flu vaccine. This is a gift that you can give to yourself or to your family if you've not had it yet. And I know there was a concern at one point, or there was some rumor that the flu vaccine causes people to be at risk for COVID virus, and this is not true. We want to protect people from having the flu because we don't want them to be showing up with symptoms that might be related to the flu or to the COVID, and we have no idea for us what we are dealing with.
Thank you. I don't see any other questions. Dr. Munkarah, you mentioned preparations for the vaccine distribution. Do you have any idea when that might happen, or what's the timeline on that?
We continue to hear that it's going to be soon. Honestly, we've not been told what is the exact time we'll be getting this. We are expecting it before the end of the year. And there are a lot of rumors that we might be getting these within the next 2 to 3 weeks by mid-December. But we do not have a solid date yet.
And distribution of those, any ideas on that?
So what's going to happen, this first batch of vaccines is going to be coming to healthcare systems and counties. And within the healthcare systems, there are going to be allocations that, again, we are waiting to hear what are the number of doses that each of the hospitals will be getting at that time. The indications also of the vaccines are still being worked out, both at a national level as well as at a local level. We know that the first phase will include healthcare workers, essential workers, and the vulnerable population, the elderly, people with comorbidities. But without knowing exactly the number of vaccines we'll be getting the first batch, it's going to be very hard to determine how it will be exactly deployed. So we are developing a long list at the present time, and the team has worked very, very diligently to make sure that we have all the list of people who qualify for the vaccine, where we are going to give it. We said that we have the freezers, we are setting the location, how to inject it, who will be inoculating the individuals who need the vaccine with the injection. Remember, this is a vaccine that's going to need 2 doses. So the Pfizer vaccine is going to be done on day 1 and 3 weeks later. When the Moderna vaccine will be available, it will be day one, and then 3 to 4 weeks later. So it will also need coordination, because unlike many other vaccines, when we usually get 1 dose, like the flu vaccine is 1 dose, the Pfizer vaccine is going to be 2 doses.
Thank you for answering that question. We have a question from Will Callan from Michigan Radio. Will?
Yeah, thanks for holding this. I was just hoping you could give a little more detail on what you mentioned about high call volume going into your call centers. About how much has it increased? How long are the people calling you waiting to get the information they need?
Well, we'll be happy. I don't have those statistics in front of me. Happy to tell you the number of calls we are getting. But with the numbers rising, these calls are coming from a variety of individuals asking for specific information on COVID. What are the numbers? What can they do around the holidays? How to do testing? Where could they get testing? As well as the regular calls that we usually get with respect to non-COVID care. But Tammy will be happy to share with you the total number of calls that we are getting, once we are off this update.
I also had a question about the Eli Lilly treatment, and I was wondering, is there enough that you've been given to give to everybody with mild to moderate symptoms, and if not, how are you allocating that treatment?
So
or planning to?
Yeah, with respect to the monoclonal antibody, what we have received so far across our hospitals are around 450 doses. I think we have about 455 exactly as of this morning, what I've heard from our pharmacy. This is the first allocation. And our team is working at the present time to determine, again, the priority list. But what we're going to do is we need to kind of provide this antibody to anyone who needs it as they come to us. So initially what we're going to do is these are going to be screened by our primary care physicians, emergency physician, infectious disease physician, depending on their symptoms and depending on their criteria. We've developed specific clinical guidelines that are completely aligned with the scientific evidence at the present time. And we are just providing it from when somebody qualifies for that antibody based on these clinical necessities, we are going to schedule them, go ahead and schedule them. We are hoping that we continue as these batches come up, whether it is with the Eli Lilly or the Regeneron, we continue to get a batch after the other, but we are going to use the clinical criteria, necessity, and our physicians screening people to say, yes, you qualify based on the clinical criteria, and we'll schedule you accordingly.
Thank you, Dr. Munkarah. I don't see any other questions. If anybody has one, if they'd like to ask. With that, we'll wrap up our COVID-19 update with Dr. Adnan Munkarah. If you have any additional questions, please feel free to email mediarelations@henryfordhealth.hfhs.org. And again, the link to the recently issued press release about the vaccine preparation, the link is at the henryford.com newsroom. Thank you, Dr. Munkarah. Happy Thanksgiving, everybody.
Thank you, Tammy. Happy Thanksgiving to all.